Thanks so much, Jessamine. Well, it's a new year, but Louisianans are still being faced with many issues. Senator Bill Cassidy this morning joining us to tell us what we're up against this year and what he hopes to do. Senator, thank you so much for being with us this morning.
Thanks for having me.
Absolutely. So let's get right to it. It's going to be a very busy year. First, we want to talk about the Omnibus Package, which I want you to explain to us a little bit about what that is and why you voted against that.
Yeah, the Omnibus is how we fund government. You need to have government funded. Okay, we get that. But the way the process works is awful. They give you a 4,000-page bill, 3 days to read it, then the government shuts down and you go home for Christmas if you don't pass it. And so it's just a wrong way. It takes power away from the American people and it gives it to a very few. Now that said, so I voted against it.
Yes.
But there were some things in there I liked.
Okay. One
bill that I had, which I passed, is called the Pregnant Workers Fairness Act. We were talking about your baby, 1 year old.
Yes.
This would give an employer permission to give an employee who's pregnant an extra bathroom break, a stool to sit on if she has to stand up most of the day.
Yes.
Without having to give it to everyone else. It's based on a case out of Louisville, Kentucky. A police officer, doctor said, needs a stool. They wouldn't give her the stool to stand on. They were afraid they'd get sued by others. She lost her job, 8 months pregnant. So now we give the employer the permission to give the extra bathroom break.
Yes, which is great news. I know a lot of pregnant women don't have the option to, once they have their baby, they have to get right back to work, Senator. So this is huge news for them.
It is. And it's good for the employer because he keeps a good employee.
Yes.
But it's also good for the baby and for the family. So Pregnant Workers Fairness Act, we passed it, very proud of that.
Yes. Now that brings us to our next subject here, and you're demanding answers from the Department of Homeland Security on why they failed to properly file tens of thousands of notice to appear documents for illegal immigrants. Why is this important for Americans?
So people come across the border illegally, and as people in Shreveport know, they're sometimes just dispensed across the country, but they're supposed to come back to court. If the federal government, Department of Justice, does not file to the court that somebody has to show up, they don't have to show up, and the court dismisses the case. It's a way to backdoor legally approve somebody being here.
Yes.
And the Department of Justice is doing it 60,000 times a year. And now that is not the way it's supposed to work. We're a nation of laws. And if the Department of Justice is not fulfilling their portion of it, we become a nation of the Biden administration deciding that we want you to stay here even though you came illegally.
Yes.
So protesting against that, trying to get the Department of Justice to do their job.
Senator, do you think that our safety could be at risk if nothing is done about that?
Well, you just got to control your border.
Sure. I
mean, the fact is that a nation has to be able to say you can come and no, you cannot. And when you look at how many people have come across the border, particularly since President Biden took office, it's just out of control.
It's not all grim, though, Senator. Bringing it back here to Louisiana, thanks to your efforts, the No Surprises Act that passed into law has protected millions of Americans from surprise medical bills, and this is great news.
It really is. Surprise bills. You go to the hospital, you think it's in network. Turns out you get a bill for tens of thousands of dollars for a piece of equipment that was out of network. You reasonably thought, no, I go and everything's covered. So what we did with this law is take the patient out of the middle. If you could reasonably assume that it was going to be covered, it's covered.
Yes.
Now, if the hospital doesn't like it, or the doctors or the insurance company doesn't like it, they go at each other. But you're out of the middle. It was signed into law in January of this year, and we're told that it has prevented 12 million surprise medical bills for 9 million patients.
Yes.
By the way, if someone gets a surprise bill, there's a 1-800 number you can call the federal government, a 1-800 number you can call the state government. We will get that to you to put on your website, or you can go to our website, cassidy.senate.gov, to get that information.
Yes, Senator, thank you so much for being with us this morning. We'd certainly appreciate all of your insight, and we'll let you get back to work. We know 2023 is certainly going to be a very busy year. Thanks again for being with us.
Thanks, Fernanda.
Jessamine, back to you.